My name is Madison. I'm a registered vascular technologist here at Ozark, and we do ultrasounds on just about every patient that we see here. There's no ionizing radiation. It's more affordable to use ultrasound, and it's non-invasive. We do multiple exams such as carotids, aorta. We do arteries and veins in both arms and both legs, so we can look at a lot of different things with just using ultrasound. Today, I'm gonna talk to you about the most common type of exam that we do here. The first part is consisting of an ABI, which is an ankle brachial index. And the second one that we typically do is an ultrasound of the legs. We typically start with placing blood pressure cuffs on both arms and both ankles. And what that is doing is it's showing a systolic pressure in both arms and both ankles. And if there is a drop in pressure, that shows us that somewhere between here and to the ankles that there could be a blockage in the arteries. So this is just a baseline test that we perform on most of our patients here to just get a general idea. Do they have arterial disease? Do we need to go on with further testing or imaging, or do their arteries look good and they're free to go? If their arteries look bad, we typically go on with an ultrasound. It's a more detailed ultrasound. We start at the groin and we scan down the leg and follow the arteries. But first, let me demonstrate with an ABI and just kind of show you what that looks like. And you'll feel this increase here. So we're just blowing up this blood pressure cuff really high, and we're waiting until that pulse is completely gone. Once it returns, then we know that that's the systolic pressure, and then we can continue this on throughout the other parts of the body here. And there it comes. So we just save that top number, then we go on to the next arm. Same kind of thing. Then we go on to the feet. And we do 2 blood pressure inflates at each foot. We look at 2 different arteries. So we look at the dorsalis pedis artery and then the posterior tibial artery. And get really tight there. So based on the findings of this ankle brachial index today, we can see that she does not have any arterial disease. However, if she did, we would go ahead and go on with the ultrasound. So now I'm going to demonstrate what a lower extremity arterial duplex looks like and what all it entails. We typically start high up in the groin where the artery off the aorta comes down into the leg. So we start as high as we possibly can. And we just follow the artery down the leg. So what we're looking for is if there's any blockages in the artery or a narrowing in the artery. So we just follow the artery down, and then different segments where we take velocities. And then based on the velocity, if it's a high velocity, that could mean that there's a narrowing of the artery. And depending on how high the velocity is, we can see, if this is a 50% or a 75% stenosis within the artery. So we just keep coming down the leg, we keep taking velocities. And then once we get to the knee, the artery split into 3 different segments. We got the posterior tibial, the perineal, and the anterior tibial. So what we do is we start down here or up here, whichever you feel comfortable with, and we just follow the artery Again, taking velocities. We also show if there is any kind of blockage. So basically, this is just a super in-depth ultrasound. You expect to be here for a while. This takes a long, long time. Each leg can take up to 30 minutes, sometimes even more. So you're sitting still. It's not always very comfortable for patients, especially if they have restless leg or they can't sit still for a very long time. But this is super detailed. It gives us a very good understanding of what's going on within the legs and the arteries. And from this, we can say the patient probably needs an angiogram and get scheduled with Dr. Stout, or everything's fine. We keep documentation of all of this the entire time. So whenever you come back, we have all of the evidence of your arteries, and after Dr. Stout fixes them, we can see, has that artery improved? Is there not a stenosis there anymore? So your arteries, they bring blood down to your feet, and your veins bring blood back up to your heart. So ultrasound is really cool because it shows direction of blood flow. So the red is coming towards the transducer and the blue is going away from the transducer. So we can see if arteries are flowing the correct way. If they have retrograde flow, we know that something's not right. The body is overcompensating and the blood is going the opposite direction. So once we're finished with the ultrasound, we wipe off all the gel, we end our exam, and then we go out to our workstation. We draw out, if there's stents in the arteries, the velocities, and then we present that to Dr. Stout and Sharon. Typically, one or both of them will come in here and talk to the patient. Most times at the hospital, you don't get to find out your results. It takes a couple of days for the doctor to come and talk to you or call you. And so with here, the results are immediate. As soon as the exam's done, they come in here, they tell you what's going on. It's very personal and they make you feel very comfortable.